I want you all to consider for a moment the vision of a food secure Nova Scotia. As our report clearly shows, there are still many significant challenges that currently exist related to access to healthy food for all in Nova Scotia. As I said earlier, there isn't one single solution. While partners of the Nova Scotia Participatory Food Costing Project have taken steps together to influence change since 2002, change that provides a strong foundation for achieving this goal of food security for all, clearly much more is needed. Income adequacy needs to be part of a comprehensive strategy to ensure a healthy Nova Scotia. Access to a nutritious diet and the opportunity to create a healthy, vibrant, and productive life for all Nova Scotians should be an equal opportunity that's available to all citizens. We must continue to work towards a healthy and sustainable Nova Scotia so that stories and experiences like you will hear from Jacqueline and from Beth will become the exception for our province. Nova Scotia has the opportunity to be a leader in taking the bold steps to ensure food security for all. Now I'd like to turn things over to Jacqueline, who will share with you her personal experience with food insecurity. What she has to share will challenge us all to think beyond the statistics and scenarios that I presented and to consider the people truly affected by food insecurity in our province. Thank you.
Hello everyone. I am very thankful to see a great turnout today. My name is Jacqueline Smith. I have 4 children. Between I and my partner, we have came in some tough times. Unfortunately, I and my partner, he was working in a grocery store in Chester. And unfortunately, things took a turn for the worse. He was demoted from his job, and before that, he was making $14 an hour. Even still, with him making $14 an hour, we still struggled with my children and trying to feed them. It was still a tough challenge. I found myself still going to the food bank at least 3 times a year, or sometimes more than that, because you have unexpected things that may happen. My 7-year-old daughter, she has a disability and she requires medication. Her medication right now is affordable to me. Her medication I have to pay $25 a month for. But my family doctor and my pediatrician wants me to change her medication, and which would cost me $90 a month. Unfortunately, I am not able to do that right now. And with that, it is very, very hard. Right now, my partner, he is working here in Bridgewater, and he took another job, and he's making 10-something an hour, so we're really, really struggling to make ends meet. And if it wasn't for family and friends, his uncle had helped us out quite a bit. And with my 7-year-old daughter, with her medication, like she can't eat during the day in the morning or dinner time. So when she comes home from school, she wants to constantly eat until she goes to bed. And she'll say to me, "Mommy, why can't you afford to give me my food that I need? Mommy, I'm still hungry. Can't I have another piece of bread? Can't I have a banana? Mommy, why are we living like this?" And it breaks my heart, because I cannot afford to feed my children like I should be able to. And even with my partner making $14 an hour, it still wasn't enough. And I just want to make that a big, big point, because a lot of people out there are thinking, okay, you're making more than minimum wage. You should be able to feed your children. But the thing is, things happen. Unexpected things. Like, for example, our vehicle broke down, so we had to have money to fix that. So it makes it very hard to do that. And with me, I am so blessed that I have close family and friends that would help out. I've been involved with the Family Support Center here in Bridgewater for the past 14 years. And through them, I learned a lot. And going and talking to them if I had a problem, they were there to help me. And I'm very thankful for that as well. And being taken part in this food costing, I've been involved with this for the past 5 years now. And it has taught me a lot, because now when I go to the grocery store, I look for the better prices. I look for things that are on sale that I be able to get. But then there are times that I can't. And I will admit it, I probably ain't going to be the first one to admit it, but I imagine there's a lot of people out there that would go to a grocery store and buy things, and you would go and pay for it, and you realize you don't have enough money to get what you need, so you have to leave things behind. And it is heartbreaking, because you don't want to, be like that, but things do happen. We're all humans. And for me to come up here today and sit and share my story with you guys, it means a lot to me. It is very heartbreaking. Because right now, making 10-something an hour with my partner, it's very hard, because I don't know what our future's going to hold. I'm hoping that something good will happen later on down the road. And with my partner, like, he just proposed to me here on Christmas Day, so we're getting married here in the summer. And now trying to plan for a wedding, that's really hard too as well. And I try to keep my spirits up high and trying to think something has to happen better. And I sit and I pray at nighttime, is thinking, please let something happen that will help our family. And for myself, I've been out there looking for work as well. It is not easy. There are a lot of places that are hiring, and I put my name in. I haven't heard anything back. So, it's very challenging times. And it really, really hurts, because, like with my partner making $14 at one time, and we still struggled. We struggled. So it is not easy at all. I'm just so thankful that I just got the opportunity to come here and talk to you all and let you guys know. Thank you so very much for listening in today.
Wow, that sure is a hard act to follow for sure. But I think Jacqueline speaks for many families that find themselves in similar situations in Nova Scotia. And from our perspective, Family Resource Centers and working in partnership with families, we believe that all Nova Scotian children and families have the right to access nutritious and affordable food. Working together in partnership with the Food Costing Project has enabled individuals who participate in family resource projects to increase their knowledge on food insecurity and to become advocates in their communities. And we also believe that education is the key to creating change. Hi, my name is Beth, and I work at the Memory Lane Family Place, which is a family resource center located in the Cobequid catchment area of the Cobequid Community Health Center. We receive funding from the Public Health Agency of Canada and the Provincial Department of Community Services to provide a range of programs and services to families. Our sponsoring organization is the Sackville Family Daycare Association, which is a 30-year-old in-home nonprofit child care program. And parents and children have been part of our organization, and over the years have worked very hard to help us develop programs that would support them. All of our work is participant-driven, and our vision is happy, healthy children and families living in a connected and supportive community.